Bigger isn't always better or smarter. In AI, a trillion parameter model is always smarter than a smaller model, but there are a few caveats that you need to know about. Today's day 19 of Healthcare AI Literacy Series, and we'll learn about parameters and why they matter. When you hear a 7 billion or a 70 billion parameter model, these aren't necessarily IQ points, they are parameters. And technically, a parameter is a learnable weight or bias within the model's neural layers that determine how a signal is transformed during inference. Think of them like the artificial synapses of an AI brain. A higher parameter count gives the model more representational capacity. Last video, we talked about the information maps available. Think of more parameters basically gives the model a higher map to work with. And this is why a small 7 billion model might understand basic anatomy, but will miss the subtle, non-linear, and complex relationships in a heart failure patient. So larger models capture these complex features as emergent properties, and they have better ability to reason through the nuance and follow higher level instructions that feel more similar to human level intelligence. But in a clinical environment, bigger size has a massive metabolic cost that needs to be considered. More parameters require significantly more VRAM and compute. Think H100 clusters versus a local server. This creates a massive friction point. Do you use a frontier model in the cloud and navigate the governance nightmare of taking your patient data from your hospital to offsite? Or do you run a quantized, smaller 8 billion parameter model locally that's private but is less capable? And never forget that size is not a proxy for truth. Larger models don't just magically stop hallucinating. Their hallucinations become more articulate and they become high probability liars. So they will use their bigger capacity to create even more convincing medical fictions. So never mistake a bigger size for better accuracy, and you still need physical grounding and verification regardless of the parameter size. Tomorrow we'll look at a RAG, retrieval augmented generation, and why that solves this LLM accuracy problem. A question for you though is, would you rather have a small private AI at the bedside or a genius AI in the cloud and deal with the governance issues?